We worked only on the right side for about 10 minutes and did a couple of things. Worked on freeing up mobility through the first rib by using a distraction technique I've developed. And we worked to free up the acromioclavicular joint. And now if I capture the spine of her scapula, I can readily induce mobility. And if I come in front and do a oblique spring test through that structure, you can see there's a lot more give, a lot more yield. And once I capture that movement, there's still freedom of mobility. Okay? And if I push inferiorly on the clavicle, you can see the force goes through that bony structure through the rest of her body. So we're allowing movement to go through a structure that previously blocked movement from going through it. You'll notice I don't use language like, sublux joints or even stuck joint is tough because it's such a system, right? You can't name one structure and say this causes that. It's a neurological system. It's part of movement. It's a fundamental principle of joints and dense connective tissues, but I shy away from really emphasizing joint. I like to call it a dense connective tissue restriction. Let's have her on her stomach, and then I think I can show it right here without having her on her stomach. You can see that I can capture that spine of the scapula and push that inferiorly. And I know that I did that with a prone, but that reflects well with what you see in prone. So I'll just ask your comments, and then we'll finish this up. So your thoughts, Larry, on this work, on this specific?
Just an incredible change in range of motion, and now there's spring. It's beautiful.
Can you film against the skeleton here?
Mm-hmm.
So just turn it, right there. You can pan and then up. Mm-hmm. And so would you stand up, please, and move both arms around and give us some feedback? And then test horizontal movements. Yeah. Okay. Good. Any thoughts?
Feels good.
How does it feel? What does that mean?
Feels looser.
Okay. What I can easily see is that this shoulder girdle is not protracted anymore. This one is. This one is still very forward. It's not even subtle. Okay. So let me see if I can capture that. I don't know if one, can you really see depth on a with a video camera? I don't know. Okay. So I'm just not sure that you can see that, but there it is in case we can. So I'll stop filming here, and I'm going to spend about 10 minutes on the other side. And after that, of course, we teach you ways to keep this mobility and look for strength deficits, coordination deficits, etc. Endurance. Okay, so I'll stop filming now.